The Approach to Runny Nose by Dr. Mohammed Gamil. Any patient symptom should be analyzed by history taking. In our case, it's a nasal symptom, so we should ask about the age. As if it's since birth, we can think about a congenital disease. If it's an old age, we can think about tumors. The sex. Some diseases are confined to special gender as angiofibroma, which is strictly in males. Occupation. Woodworkers are susceptible to nasal carcinoma, and special habits as nasal crusting is common in cocaine addiction. After that, we have to take the complaint in patient own words and in parents' words in case of children. Example: Doctor, I have an excess nasal secretions, or Doctor, I have a runny nose. Then we should analyze the complaint. This is called the present history. We should know the onset, is it sudden or gradual? Onset, was it associated with a common cold, a trauma, which can be CSF rhinorrhea, allergic symptoms like sneezing attacks? The course, is it progressive, as in nasal tumors? Stationary, as in nasal polyposis, and intermittent, as in allergic rhinitis and vasomotor rhinitis. Also, we should ask about the duration. Then we should ask about the nature of these secretions. Is it mucopurulent or purulent? As it can happen in any cause of nasal obstruction. Is it bloody, which is called epistaxis? Is it watery, as in CSF rhinorrhea, allergic rhinitis, vasomotor rhinitis, and early acute viral rhinitis? Also, excess secretion of lacrimal glands, apart from emotions, can cause watery rhinorrhea. What if there's food and water from the nose, which is called regurgitation, which can be found in perforated palate, like in syphilis and after maxillectomy, or paralysis of the palate, as in bulbar palsy and in cleft palate patients. And it can be crusts, as in atrophic rhinitis and in cocaine addiction. We have to know if it's bilateral or unilateral nasal discharge. At unilateral nasal discharge, if it's mucopurulent and purulent, like any cause of any unilateral nasal obstruction. If it's bloody, which is called epistaxis, also unilateral watery discharge, is usually CSF rhinorrhea. What about water and food coming from one side of the nose? It's usually from oral maxillary or oronasal fistula. What about crusts? Unilateral atrophic rhinitis, example in total turbinectomy. After finishing history taking, now we have a provisional diagnosis which will direct us before examination or asking for investigation. We can have a case as an example. A patient presented to the outpatient ENT clinic. The patient was 24 years age, female, housewife with no special habits of medical importance. She complains of excessive nasal secretions. The onset was sudden, started to happen after minor forehead trauma. The course was stationary but increased on leaning forward. The duration started 3 weeks ago, just after the trauma. The nature of the discharge is watery now, but showed some blood not excessive with trauma, but the bleeding stopped early and the watery discharge persisted. The watery discharge comes from the left side, but when lying on her back, a salty taste is felt in her throat. After that history, we should nearly reach a provisional diagnosis of CSF rhinorrhea, which must be confirmed by making the patient lean forward and strain or cough. You should see a dripping water coming from the left side. Then, to be more sure, a biochemical examination to the fluid will confirm diagnosis. Then finally, CT scan with intrathecal dye will detect the leak.